Depression is much more common in people with diabetes than many people realize. If you have diabetes, you are about 2 times more likely to develop depression compared to someone without diabetes. This is not just because living with diabetes can be stressful. Research shows that high blood sugar, inflammation, changes in brain chemicals, poor sleep, and the daily burden of managing diabetes can all increase the risk of depression. Depression is not simply feeling sad for a few days. It is a medical condition that can affect your thoughts, emotions, energy, sleep, appetite, and motivation for weeks or even months. Many people with diabetes do not realize they are becoming depressed. They may think they are just tired, getting older, or feeling stressed. But untreated depression can make diabetes much harder to control. When someone feels depressed, they may stop checking their blood sugar regularly. They may skip exercise because they have no energy. They may also eat unhealthy comfort foods or skip meals completely. Some people forget to take their medications on time. Others simply lose interest in taking care of themselves. This can lead to higher blood sugar levels and increase the risk of serious complications over time. Research shows that people with both diabetes and depression have a higher risk of heart disease, kidney disease, nerve damage, and early death. The good news is that depression can be treated. Many people feel much better after receiving the right treatment. Treatment may include counseling, healthy lifestyle changes, regular exercise, better sleep, stress management, and sometimes medication. Today we will mainly talk about antidepressant medications that are less likely to make you sleepy and have a lower risk of causing addiction. Many people worry that antidepressants are addictive. This is a very common misunderstanding. Most antidepressants are not addictive. They do not create cravings like cigarettes, alcohol, or sleeping pills. They also do not make people constantly want higher doses. But stopping some antidepressants suddenly can cause temporary withdrawal symptoms. That is why doctors usually recommend reducing the dose slowly. This is called tapering the medication. Now, let us look at the medicines that are usually less likely to cause drowsiness. One of the best known medicines is bupropion. Doctors often prescribe bupropion for depression because it usually does not make people sleepy. In fact, some people feel more energetic after taking it. Research shows that bupropion has a very low risk of weight gain. This is important because many people with diabetes are also trying to manage their weight. Some people even lose a small amount of weight while taking it. Bupropion also has a very low risk of sexual side effects compared with many other antidepressants. But bupropion is not suitable for everyone. People with epilepsy or a history of seizures usually should not take it because it can increase the risk of seizures. Another commonly prescribed medicine is fluoxetine. Many people know it by its brand name, Prozac. Fluoxetine is usually considered one of the more activating antidepressants. It is less likely to make people sleepy compared with several other antidepressants. Doctors often recommend taking it in the morning because it may increase alertness. Fluoxetine is not addictive. Research has shown that it works well for many people with depression and anxiety. Some people notice nausea or headaches during the first few weeks. These side effects often improve as the body adjusts. Another option is sertraline. Many people know it by the brand name Zoloft. Sertraline is one of the most commonly prescribed antidepressants in the world. Most people do not become very sleepy while taking it. Some people actually feel slightly more alert. Sertraline is also not addictive. Research suggests that sertraline is generally safe for people with heart disease, which is important because diabetes increases heart risk. Like other antidepressants, it may cause mild stomach upset when treatment begins. This usually improves after a few weeks. Another medicine is escitalopram. Many people know it as Lexapro. Escitalopram is usually well tolerated. It causes less drowsiness than many older antidepressants. Many doctors choose it because it has relatively few drug interactions. It is also not addictive. Some people notice mild nausea, headache, or sleep changes during the first few weeks. These symptoms often become much better with time. While we are in the middle of the video, If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Another medicine worth mentioning is venlafaxine. This medication works for both depression and anxiety. At lower doses, it mainly affects serotonin. At higher doses, it also increases norepinephrine, which may help improve energy in some people. Most people do not become very sleepy while taking it, but it can slightly increase blood pressure in some people. Doctors may check your blood pressure regularly if you take this medicine. Another medicine is duloxetine. It is often used for depression. It is also used to treat painful diabetic nerve damage. This means it may help people who have both depression and diabetic nerve pain. Research has shown that duloxetine can reduce nerve pain while also improving mood. It usually does not cause much drowsiness. But some people may feel sleepy during the first few days. This often improves as the body gets used to the medicine. Now, let us talk about medicines that are more likely to cause drowsiness. Some antidepressants are actually chosen because they help people sleep. Examples include mirtazapine, amitriptyline, and doxepin. These medicines can be helpful for people who have severe insomnia, but they are usually not the best choice if you want to stay alert during the day. Some of these medicines may also cause weight gain. For people with diabetes, this can make blood sugar control more difficult. That is why your doctor will choose the medicine that best matches your health needs. Many people also ask whether antidepressants affect blood sugar. The answer depends on the medication and the individual person. Depression itself can increase blood sugar because stress hormones become higher. When depression improves, blood sugar control often improves as well. Some antidepressants may slightly increase weight. Others have little effect on weight. Bupropion is usually considered one of the better choices if weight gain is a concern. Exercise can also help depression. Research shows that regular physical activity can improve mood by increasing natural brain chemicals that help people feel happier. Even walking for 30 minutes most days of the week can make a difference. Good sleep is also very important. Poor sleep can worsen both depression and diabetes. Try to go to bed at the same time every night whenever possible. Eating healthy foods also supports brain health. A balanced diet with vegetables, fruits, whole grains, healthy fats, lean protein, and plenty of fiber can help support both mood and blood sugar control. Talking with family and friends can also help. Depression often makes people feel isolated, but sharing your feelings with someone you trust may reduce emotional stress. Professional counseling is another effective treatment. Many people improve with talking therapy alone. Others do best with both counseling and medication. It is important to understand that antidepressants usually do not work overnight. Many people begin to notice improvement after 2 to 4 weeks. The full benefit may take 6 to 8 weeks or sometimes longer. Do not stop taking your medication just because you do not feel better after a few days. Give it enough time to work unless your doctor tells you otherwise. If you develop severe side effects, contact your doctor immediately. Never stop an antidepressant suddenly without medical advice. Stopping too quickly can cause dizziness, anxiety, nausea, flu-like symptoms, and sleep problems. Reducing the dose slowly is usually the safest approach. If one antidepressant does not work, it does not mean all antidepressants will fail. Many people find the right medication after trying a different one. Your doctor may also adjust the dose before changing medicines. Depression is a real medical condition. It is not a sign of weakness. It is not something that people can simply overcome by trying harder. The right treatment can improve your mood, your energy, your relationships, and even your diabetes control. If you have diabetes and you've been feeling sad, hopeless, tired, or have lost interest in activities you once enjoyed for more than 2 weeks, speak with your doctor. Getting help early can make a big difference to both your mental health and your physical health. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos.